Yo, yo, yo. What's going on, everybody? Another day, another night, whatever time it might be, and whatever state that you might be in right now. Uh, since this is YouTube, there's no telling where this video might be reaching, And it's my intent to give awareness of Leukemia AML, and I'm also having a bone marrow transfer, and I'll be vlogging that every day while I'm actually in the hospital. Every day I'll be sharing my experience, how I feel, the good, the bad, the ugly. I got to go through chemo, I got to go through radiation. I think I do radiation for like 4 days, and each day that I have the radiation, I think I do it 3 different sessions a day. So yeah, I do that for I think 4 or 5 days. I'm not for sure. And then after that, I have to do chemo, a strong chemo for, I think that's just for 2 days. And then after the chemo, then they'll do the bone marrow, which is basically something like a blood transfusion. They're not actually getting your bone or going into your bone or nothing like that. They do it just like giving you blood or whatever now. So that's something that I'll be able to tell you guys about once I'm through with the whole experience. The bone marrow itself is well, let me start with the Leukemia AML. Matter of fact, let me do this, because I'm all over the place. And somebody might have just tuned in and really don't know me, and I'm talking like to the people that know me and know that I've been going through something, for this past, since June. By the grace of God, I'm in recession from Leukemia AML in 6 months, which is really like unheard of. I got a lot of prayer warriors out there, praying for me, family, friends, club members. I really appreciate that. Prayers do work, for sure. I'm first-hand witness to that. And just like this bone marrow thing, as far as the percentage of you getting a bone marrow, finding a bone marrow donor, it's like really slim. Like 1 to like 20% or something like that. I think even 20% would be high. It take years, to find that donor. In less than a year, I found a match. So praise God on that. So just to go back to my story, which I'm doing this vlog because I was looking on YouTube and I was trying to find something that I could relate to kind of give me a feel of what I was going to go through when I go to the hospital and do this bone marrow procedure. Which I probably made in the hospital like 30 days or so. You know what I mean? So I was trying to get a feel of how I would be feeling, what I would be going through. And I was looking up different things, and it was kind of, outdated, and I couldn't really relate to too much that was out there. So I said, okay, when I go through this, I'm going to make sure that I put something out there, and maybe, someone can relate to me and my journey. Maybe I can help someone. So, If you got any questions, anything you want to know, make sure in the comment section, you leave a comment, question, whatever. And while I'm going through this journey, I'll answer any questions and share any knowledge that I might have. I'm going to be in a hospital, so I can pretty much find out, anything from the nurses or doctors. So, let me tell you a little bit about my story. Let's just start off from my everyday life. I was a trucker, owner op, doing my thing. Life was fine. Everything was good, And I'm trying to think back of any symptoms that I might have had. I really didn't have any symptoms, but I used to have night sweats sometimes, and they say that's one of the symptoms of leukemia. Heavy sweats. So sometime at night I would be sweating a lot. I had to change tank tops or whatever. But I was thinking like that was my body just like fighting off colds, fighting off something. I'd be on the road and I'd be like, man, I must be trying to come on with something. My body keeps sweating through the night, trying to fight it off. To my ignorance, that's what I was thinking. So, anyway, I got a bad toothache, severe, when I was on the road. So when I came home, I went to the dentist, emergency, and come to find out, they put 3 teeth in the back, 2 on one side, 1 on the other. Got tooth extractions. So when they did that, gave me some pain pills or whatever, said everything would be all right, and the pain didn't go away. I was like, man, these little medication. I'm like, I went back up to the dentist, like, man, you got to give me something stronger. The strongest you got, I need that. You know what I mean? Because this little stuff you giving me, whatever you call it, it was not working. So I got some more pain medicine and ibuprofen and Tylenol, and I was taking everything that I could, to get me through, and I took off work for like a couple weeks. I know at least it was a solid week trying to get healed up. So I went back to work and I still was in a little pain. I was just trying to fight through it. So I went out for a week, came back, and the pain was still there. I went back to the doctor, to the dentist, like, man, it's not working. I still feel pain, this and that. And then at this time, I felt a bone was like coming up through my gum a little bit. So I was like, I got this bone coming out. Like, what's going on? Is that my tooth, or, did you leave some teeth in there? What's happening? So he looked at it, and he said the bone was coming out a little bit. I guess it had merged out. He just had to sand it down a little bit, take some antibiotics. I would be fine. All right, cool. So he did that, gave me some antibiotics. Man, pain didn't go away, But I'm like, let me give some time to work. So I went back on the road for about a week, came back, pain never left, Then I went to another dentist. Like, let me get somebody else's opinion, because this dentist, he must not know what he doing. So I go to another dentist, and I tell him I got the bone shaved down or whatever. So he looking at it, and he do his thing, give me some more antibiotics, say this shit, should take care of you, should be straight, take these antibiotics, and if this don't work, then, you got to go to a specialist or whatever. I was like, all right, cool. So went back to work, came back another week. I think I waited like 2 weeks. Like 2 weeks, I was thugging it out. You know what I'm saying? Like, man, maybe this shit got to get in my system, whatever, So I go back 2 weeks, no good. Send me to the specialist. Go to the specialist, and he says that he's he gonna do surgery. You gotta cut the gum open, go in there, whatever, with the bone. Same thing with the bone and all that. And I'm like, all right, cool. So he does that. And now this time, I was like I was gonna take a couple weeks off. So I said I'm gonna take care of my teeth and, you know, take a couple weeks off or whatever. So I'm thinking that I'm talking because it's been a little minute, you know, since this happened. But anyway, I took a couple weeks off. I went to the dentist, thought took care of that, and then I was like, well, since I'm off, let me go ahead and take a physical. You know, I'm 50. You know, I'm 50 years old. Let me, you know, get some blood work done and this and that while I'm off too. So I go get some blood work done, and then my daughter, she had a graduation. So the next day after I did the blood work, I was going to her graduation. So I was on the way to her graduation, and the nurse called me and was like, are you around? And I was like, no, I'm not in the area. And it's like, you need to come back up here because your blood level is extremely low. And I was like, okay, well, you know, I've been taking all kind of antibiotics and ibuprofen and Tylenol. I've been doing that for months. You know what I'm saying? Trying to get rid of this pain in my mouth. So maybe that might have something to do, because I think I heard that that ibuprofen make your blood level low or something like that. You know, so I was thinking maybe that was it. And she was like, no, you need to come back up here. And I was like, okay, you know, I'll be there, and I'll let you guys know. So I went on with my daughter graduation. You know, I did that, and I was in a lot of pain. Like, the pain just started getting like almost unbearable, you know. So, and I was in Vegas now, and I rode to you know, to California to do it for her graduation. So I rode out there to the graduation, and I was gonna stay for a couple of days, but I ended up coming right back after the graduation that next morning because the pain was so bad, you know. And my daughter actually was coming back with me. She was gonna go on the road with me for about a week, you know. So I was looking forward to that, you know. So when we came back, on the way back, they called me again, and like, you know, I need to come up there. They really want to check my blood, this and that. And I'm like, all right, cool. So I go, I get my blood work done, and it was like, no, you know what? That's not what happened. I didn't even go then. Like, later on, I didn't go to the next day when I was at home, because I woke up and I wasn't feeling right. Something wasn't feeling right. You know what I mean? So I was like, I need to go ahead and go to the doctor, you know, and see what's going on. So I did that. And once I did that, they ran my blood and everything, and my blood was abnormally low. It was like I ended up having to get a blood transfusion and everything, you know. So next thing I know, I'm waking up, you know, I'm in the hospital after a blood transfusion and all of that, and I got a cancer specialist, you know, standing there, you know, telling me that I have leukemia, AML. Matter of fact, acute, I think it's called acute leukemia AML, meaning it's aggressive, you know. And at the time, leukemia, cancer, it's a blood disease. So the cancer, it affects your blood. So when the specialist told me that my blood cells was infected, like 75% of my blood cells was infected. So I'm like what? You know, like tripping. Like, he's like, you're gonna have to do. We're gonna give you the what is it? Leukemia? No, not leukemia. The hey, what is it when you not the radiation. I'm doing the radiation and I'm doing the chemo. Chemo, yeah. They said they're gonna do strong chemo, like 7 days, 3 days off. 7 days straight. They gotta give me 7 days straight chemo, like tomorrow. You know what I mean? And I don't know nothing. I didn't know too much about cancer or anything like that. I know it was a deadly type of thing. I don't know anything about chemo. I just hear bad stories about chemo. So my education was very limited. At that time. So when he told me that, I'm like, man, like what options do I have? And he said, you don't have no options. He was like, if you don't do this chemo, you probably only have like 20 days to live. So imagine out of nowhere you just hearing that, like it just shook me up right now just thinking about that, because it put me back in that space. You know what I mean? And it was like, wow. So I'm in the bed like, I guess we gotta, we gotta do then. You know what I'm saying? We're gonna have to take this chemo and run with it. So that's what I did. My family was in deep prayers. We prayed strongly, and we went on in there. And I did the chemo 7 days straight. It was rough. I mean, I was using the bathroom on myself, and that gotta be the worst thing for me when you can't hold your bladder, or nothing. You just going. That was hard for me to deal with. But yeah, I went through that, and it was really hard. It really was. But I stayed prayed up every day. We praying. I thank my moms, family, friends, everybody. For the most part, stood by my side. And it's crazy when you're going through something like this. It like really lets you know who's who. And sometimes the one person that you feel like that would be there no matter what, that you really feel would be there, besides your mom, but all the times it don't happen that way. You know what I mean? So I'm a testimony to that. Like, some people that I thought that was gonna be there, ride or die, it didn't work out that way. So that was a battle too, when you in there fighting for your life, and you feel like, certain people already got you counted out. You know what I mean? Some people have me already counted for dead while I was in there fighting. I felt that way, like they gave up hope on me. So I'm a fighter though. I've always been an underdog. You know what I mean? So I got through that. So I did the chemo and all of that, and it didn't work for me. It didn't work for me. So they like, your blood cells are still infected. You know what I'm saying? And I'm like, man, I thought this was, it's for to knock everything out. What do we do? So the hospital I was in was a good hospital. It was the hospital in Vegas, I think Sunrise. This was called. It's where Tupac was, where he died at. So that was a real good hospital. They had good specialists there, whatever. So it was like, it's these new pills that they have. these chemo pills that you could take, you know, and they're getting your system, and they do the same thing, you know, as in the chemo that you do as far as the injections. Because when I was in the hospital, they do it through the IV. That didn't work for me, right? So the pills is less stronger. The IV is stronger than the pills. So they were gonna try the pills on me and see how that works. But the pills they're still being tested. So there's no guarantee on that, you know. So that's the situation that I was in, the status that I was in while I was in the hospital. So like I said, some people counted me out. So I got to feeling a little stronger, and the chemo pills, they start kicking in, and, you know, my body start accepting the chemo pills, you know, little by little. You know, it was helping me out. So it helped me out enough for me to get out and be an outside patient, you know, and deal with this other hospital that was specializing in cancer and this and that. So that's what I ended up doing. So after about 6 months or so, you know, I'm going back and forth to the hospital at first it was every week, once or twice a week, you know. They put I had a port in me, and they were like, you know, just checking my blood, you know, seeing how my blood was doing as far as the cancer, you know, if the percentage was going up or going down. You know, my platelets was low, you know, different things was low. You know, my immune system was low, you know, everything was like low. So I was out, but I was in. You know what I'm saying? Like out of the hospital, but I'm really like inside, like laying low. You know, so for everybody that know me, you know, that wanted to see me and wanted to be there for me, you know, your prayers and everything, you know, they help. I mean, I'm still here. You know, I never tried to dodge nobody. You know, like I said, I couldn't be around no one because my immune system was extremely low. You know, and getting a common cold could have laid me to rest. You know what I mean? So I had to move, you know, carefully, you know. So I'm doing that, you know, I'm doing that for months, you know, slowly but surely, you know, I'm getting stronger, you know, I was getting stronger, and was doing what I had to do. And after about 6 months or so, you know, it came back that they couldn't find no more leukemia in my blood cells, you know. So the pill worked for me, you know, and I'm in remission right now. But by me being infected so much, there's a good chance that years later it could come back. That's where the bone marrow come in. That's why I was such a good candidate to do a bone marrow, you know, because they say they do a biopsy and check and see, you know, how your blood cells is looking and this and that. But they said sometimes it could be, you know, a blood cell that's infected with leukemia, and it's like hid away somewhere where you can't see it, and years later it comes back, you know. So when you do the bone marrow, that's putting new blood cells in your body from another donor that's your match, you know. And what that does, the blood cell go in and they do whatever they do, you know what I mean, and they'll fight off whatever infected cells that might be in there, and you know, and whatnot. But your body has to, you know, connect with the new blood cells that's coming in. So that's why when you do the bone marrow transfer, you know, you be down a while in the hospital because after the procedure is actually done, then they have to monitor you, you know, heavily to make sure you don't have no infections and, you know, all kind of different things that can happen. You know, so you're going to be on close watch for a minute, see how your body reacts. And then once everything is good and you get up out of there, then you still have to be monitored for a minute. It's a process, you know, it's a slow grind. You know what I mean? But it just, you know, excuse me, because this is real and I'm actually going through it right now. It's hard even making these videos and these vlogs because it's not nothing I'm talking about, just talking. This is something I'm really experiencing in my life. You know what I'm saying? It's like, you know, you wake up one day and your whole life turned upside down. You know what I'm saying? Like, man, I haven't been able to work in almost a year. You know? So that's man. And by me saying that, you know, let me not forget, I appreciate, you know, my loved ones, my family, the support, like I said before. You know, special shout out to my club, Black Knights MC. You know what I'm saying, up out of California. It's my riding club right there. You know, I ain't been around. You know, they know I've been down. You know, they put something together for me in the very beginning, you know, when I said I was cool. You know what I mean? I said I was cool. And that really meant a lot for me. Like, they went out their way anyway. Like, no matter you say you cool or not, we're going to make sure, you know, that we look out for you. You know what I mean? And that, man, that touched me a lot. Really, really appreciate that, loved ones. For real. You know. Everybody that's been by my side, I know it's been a journey. You know, everybody's happy and smiling because they see, like, you know, we doing this, you know, we doing this, putting God first, you know what I mean, never giving up hope, you know, keeping faith alive, and just knocking this thing out. You know, it's been hard, it's been a journey, it's not no easy thing. Like I said, you know, everybody not gonna stand by your side. You know, you're gonna lose some people in the process, you know, but you can't lose your mind, your sanity. You know, I could have lost it in a hospital bed. You know what I mean? Cause it's a cold feeling it's a cold feeling, man, when somebody walk out on you and you just like, you just never would have thought that would have happened, but you can't do nothing about it. Cause you ain't got no choice. You trying to live. You know? Anybody that deal with you they got a choice. They could deal with you, or they could say, I can't deal with it. You know what I'm saying? But if you want to live, you ain't got that choice. So you got to stay strong. So if anybody out there, you going through this fight, like I'm going through it, you don't remember nothing else, you remember that. You got to stay strong. For you. Only you can do it. Keep God first. Stay prayed up. Hey, you see me? This journey almost over for me. You feel me? Oh, it's gonna be all to the good. I'm gonna keep vlogging for a minute, let you guys know how I'm doing even after it's over. You feel me? But like I said, I just wanted to get a little bit more in depth. You know, I made a couple videos already, just, you know, at the hospital, you know, here and there, you know. But I'm getting ready to be admitted, and I'm gonna be in there, and I'll be drugged up and, you know, going through actual chemo and all of that. So I don't know what stage of mind I'm gonna be in all the time. So I'm telling you guys right now, while I'm not on no medication or anything, I was sharing a little bit with you guys, just giving you a little insight. You know, this is not nothing planned or nothing like that. So, you know, I'm just really like freelancing it. You know, that's why I might be all over the place, but I'm just coming from the heart, you know, and like I said, you know, maybe I can help someone out there, you know, to get a better understanding. And I'm pretty sure when this thing is all the way over with, it'll be something good for the people that do need a bone marrow. Give education, to us, to our people, So on that note, I guess until the next vlog, which will be the next time you guys see me, I will actually be at the hospital, in that hospital bed, but I ain't gonna stay laying down. I will be walking at least 3 times a day, as long as I ain't use the bathroom on myself. I'm gonna keep it moving, you dig? But y'all stay prayed up, stay praying for me, and know I'm gonna do this thing. I'm out.